Morning. Looking for my attendance sheet. Where are you girls? I can't see anybody. There you are. Good morning. Morning.
Good morning.
Morning.
Hi, Alex, are you my new student?
Yeah,
Are you my new student? Are you a Cosmo?
esthetician.
Esthetician. Okay, so you're new.
Yeah.
Right. Did I give you paperwork on this yet? Did you come in and get paperwork?
I think I did, yeah.
Okay, for chapter 14, right?
Um,
I gave you like the study guide that we're going to be working on.
oh no, I don't have any like the books or anything.
Okay, when did you sign up? Yesterday?
I think like a week ago, and today's my first day.
Huh, okay, because I sent someone home with the paperwork last week because I wanted to make sure everybody got that. So I'm sorry that you didn't. You'll end up having to take notes and try and, since you don't have a book or anything with you, if you can come by the school today, can you do that?
Yeah.
Okay, and I'll give you some paperwork so that you'll follow along with us. Okay. All right, and then we'll show you, do you have a computer that you can bring with us, a laptop?
No.
No, are you working off your computer at home?
I'm on a tablet.
You're on a tablet? Okay. Bring that tablet with you when you come in, okay? So we can show you how to log on and to get on to everything that you're supposed to get on.
Okay.
Okay. All right, let me get your name down here. Okay. Morning, Diana.
Good morning.
Sorry,
You're
I get everybody's name here real quick. Sorry, I'm like, oh, okay. Jasmine, are you new?
Yes.
Are you on my afternoon class?
I don't know, but I'm new.
Okay, cosmetologist or esthetician?
Esthetician.
Okay, and you didn't get a package either, right?
No.
Okay, so can you come in today to, so I'll be here until 4:30.
Okay.
Okay, that way you'll at least be able to follow along with us. Okay, because you're just gonna end up having to take notes from what's on the screen. Okay, when I change the screen over. Oops.
Okay.
And that's the only way I can work it today. Normally I usually get a hold of you guys before you start and like try and get you a package or something that you can work from on your first day so you're not so lost. Okay, you won't be responsible for doing the homework today, so don't worry about that. Okay.
Thank you.
All right, so when I assign it, don't worry.
Okay.
There you go. Okay, let me get everyone's attendance here. Good morning, Araceli, Yusara. Hi, you guys. Just making sure everyone's here. Let me get you all in here. It looks like we've got some new students. So my older ones, would you like to introduce yourself to our new students? Anyone can start. Go ahead. I feel you have some really good students in here. Diana, introduce yourself to her, please. Are you eating?
Yeah. I don't want to be disrespectful.
I know.
Good morning.
It's nice,
I'm
huh?
Diana. I'm kind of like halfway through the class, but
I
here
can't
am.
believe you guys get to eat and everything in there, you know, coffee, whatever
That's,
you want. Huh?
that's the benefit for me is the eating part.
Yep.
So
And I can't get anything, okay? And you know, I'd be snacking in a heartbeat. All right. Alex, Jasmine. Oh, where's my other Jasmine? Oh, that's right. She's not coming in because she's got 2 hours to do on Thursday. That's it. So I get one going out and one coming in. Okay, I'm fine. I just needed you to turn it on in order for it to work. Sorry. So we should be on page, let me see. Did we finish with rhinoplasty? I wasn't sure on last week. So on page 434 at the top of the page, did we actually get that in there before I kind of broke to homework? I'm not sure if I did. So I'm going to cover that just in case, you know, someone didn't get that information to put into their study guide. What's going to happen, Jasmine and Alex, is that I will go through the lecture with you and it helps you put the information you need into your study guide. Your study guide is basically a small condensed version of the book. Now, that doesn't mean that you don't need to read the book, because you definitely need to read the book to understand it. But when you're getting ready to study for it at the end, you'll be able to kind of put the pieces together with just looking at like parts of it. Does that make sense? Because that study guide's got the most information that you need, okay? But you've got to have the background in on all it. So that's what I mean by you have to actually read the book. Otherwise, you're not going to understand it. But Jasmine, do you have a tablet too, or something to bring in so I
Computer.
can show you how to work?
Yeah, I have a
on it?
laptop.
Yes, okay, okay, good. All right, just make sure everyone's in here. I think I'm just waiting for,
Sorry, my computer's being super slow this morning.
that's okay. Gotcha. I usually don't come on here because for a while we weren't even getting started until like a little bit after 10. So I like just plug in sometimes a little bit before, maybe 5 minutes, sometimes only a couple minutes before. So don't don't think that you couldn't get in there. It's just me.
Yeah.
I start doing paperwork and I get all sidetracked. All right, so I've got everyone in here. If you have your package or your study guide with you, we are on page 434. Yusara, do you know where we're at? You're on page 434 in your study guide, hon.
Yeah, I know.
Okay. And it's pages 518 to 519 in your textbook. Okay, Araceli, do you have your book? Sarah, you've got yours up, right? I can't see you, Araceli. Yeah, a little bit farther
I have
down.
it, yes. Sorry.
Okay. Usually have to have some a person up there where I can see you. All right. So we stopped off, and I'm just gonna fill this in. Let me change the screen so you guys can see what we're gonna be working on. Hold on a second. All right, let me know when you have this screen up. Okay. Everybody got this on their screen? It should say rhinoplasty, right? Okay. In that
Yeah.
upper part of your study guide where it says rhinoplasty, all right, you're actually going to put into that area surgery to reshape the nose. And it can also alter the size and shape of the nose or narrow the span of the nostrils. It can change the angle between the nose and the upper lip or correct birth defects. Okay, all of that goes into that upper portion for the rhinoplasty for nose surgery. The best thing I can tell you, you guys, if you could take a picture of this, that'll help you, okay? Take a picture of my screens when they come up, at least for right now. Because you haven't got your books downloaded or anything. So once you get your books downloaded, all of this stuff that we're going through right now, will be able, you can pull it up at home, okay? And I'll show you how to do that. That's why I want you to bring your tablets or your computer, whatever you're gonna be using, okay, down here, so we can get you situated. I'm just gonna let you know that some of the girls have decided, most of the girls, I'm like all of them, have ordered books online because it's a little easier for them to be able to fill it in with their hands. Who has an Apple that they're using? Okay, good, of course. All right, when you come in here, we're gonna have to download it a certain way. Otherwise, when you go into the program and you try to type in the homework assignments and stuff, or even this part, what happens is it doesn't save it. So that's why we're gonna bring you in and show you how to do that. That's why they ordered the books. Now you can order the books for just a little bit longer because they're not gonna have them much longer anymore because they're gonna bring out a new set of books, like ASAP. So the other thing I can tell you is you can go online to eBay or, you know, one of these places where you can buy used books, okay, at least for the textbook. The study guide, you really need to have a new one. But sometimes people buy it and they never use it. So you can try that also. But I'll let you know what that is when you come in, okay? All right, so in your rhinoplasty nose surgery, for the results, you're going to put in there, it reshapes the nose. Okay, it's recommended for patients who wish to reshape their nose for either cosmetic or reconstructive reasons. The side effects are going to be temporary swelling, bruising around the eyes and the nose, and headaches. Recovery time is usually normal activities resume in about 1 to 2 weeks. Avoid hitting the nose for at least 8 weeks. I can say that takes longer than that because a friend of mine he walked into a wall and his nose was on the side of his face. So, and it was almost a year since he had it done. So it takes a little longer. The complete healing takes place in about a year. So the duration of the results is permanent. And they usually don't have to do anything else to it unless some trauma has been done to the nose since then. So I'll give you a couple of minutes to fill that part in. While I'm waiting, my newbies, did you get your stuff for your state board kit yet?
Nope.
Nope.
No.
Oh, not you newbies. I'm sorry. Sarah and Araceli.
Yeah, I got like probably like 98% of it.
Okay. How about you,
I got some
Araceli?
stuff too. I got some stuff too.
Okay, so if you can bring all that in tomorrow, okay, or text me something that you need, maybe I can get it together. You know,
Tomorrow,
pick up a piece
Wednesday or
something here and
Thursday?
there. For Thursday.
Okay.
Okay. Natalie, you weren't here, so what I'm trying to get the girls to do is to have a state board kit put together. Do you have anything left from your other school?
No.
Nothing? Okay, I'm gonna send you the list, okay, and you're going to bag it as such. So I'll write down the instructions for you so that you can have it done. I want you to get it today because I'd like you to try and put it together tomorrow. And if you have any questions, you can ask me so before we start the class on Thursday. Okay, because you're in the same group as they are as far as where I started. So if not, you can wait another week and watch us do this, okay, with the girls. It's not much. I have most of the stuff here, somewhat, the bottles, I guess what's ever left you can have, you know, that's how I look at it. And then when somebody graduates, I think one of the girls is graduating, she's gonna be giving her kit up, so, okay. All right, has everyone gotten this information off the page? I guess so. Remember, I can't see all of you at one time. I have to keep turning this. Okay. All right. So go back to this and let's turn the page. Okay, this is going to be on 435 in your study guide. Okay. Or actually, excuse me, at the bottom of 434 still. Sorry. This is aesthetics in the medical practice. Okay, and this basically is at the bottom half under number 2 where it says explain the various aesthetic procedures applied in the medical practice. Okay, and this is the area you're going to put proper skincare before and after medical procedures for superior results. Okay, that needs to be put next to the aesthetics procedure in your study guide. If you haven't had it finished, I'm going to count hands now. Remember, I got to go back and forth between pages here. Here's Megan. See who actually has finished 4.1 already. Okay, so Diana, have you done 4.1? I think you have. Okay, Sarah, did you do it already?
I should have already.
What 4.1, what is that?
Okay, so that, because I haven't assigned it as a homework, that's why I'm asking, because some of the girls had already completed it. So that's going to be today's homework. Okay,
Yeah, I
good.
completed 4.1.
Okay, good. All right. Has everyone got off this information off the page? Megan, good morning.
It's already in our textbook.
Okay,
Hi.
thank you. Thank you, because I don't know that. I don't have my extra study guide books gone. And mine, it doesn't tell you whether you get it or not. Just fills it in. Oops. Here. Dermatological disorders. Ugh, big word. Okay. Not all skin problems result from disease. Some are symptoms of other diseases, such as lupus or diabetes, or can indicate a hormone imbalance. Several aesthetics procedures can help relieve the discomfort of the patient's condition. Okay, as long as there is nothing like a wound open and it's not flared up, not inflamed, you can actually work over those conditions. You just can't work over diseases that they get. So all of that whole information, that little bubble right there needs to go right where it has that on your study guide. And then I will go down to the bottom for the post-operative complications for you. Okay. So let me know when you guys have filled that in. Most of you have filled this stuff in before class. And Araceli, have you got this in your workbook, you and Sarah yet? I can't see your face, hon. Araceli? Is this part of your workbook? Your sound's off. Is this part of your workbook completed yet or not?
I got some stuff.
Okay, good. Okay, I'm just leaving it up there. That's what I want to find out. Sarah, how about you? You're on my other page here. There you go.
No, I don't have this part yet.
Okay, so I'm gonna wait for you guys. That's why I want, sometimes when it's already filled in, I can go faster, but you don't have to have it in because I'm doing it now. I just want to make sure I'm leaving this stuff up long enough for you guys to fill it in. So I have some news tomorrow for you. Sounding like good news, though.
Can we work on people?
I have to be able to tell you what it is tomorrow. It's getting close to that, yes. We'll be able to do some stuff tomorrow. How about that? Or on Thursday when you come in. That's at least a blessing, okay? You have no idea. Jasmine and Alex, they have not been able to work on people yet. Okay, some of the girls have the last time we opened up, and some were working before we even went on break, but no, the new ones haven't been able to work on clients or themselves yet. So
Are we going to be able to spray tan, Miss Janie?
probably not this week, but yes, if it opens itself up, because apparently it's opened up a little bit. I just don't know how much just yet. Okay. I know that working on yourself is probably going to be one of them, you know, for other procedures, but I'm pretty sure we can work with your screens, if you have your screens on, and your masks. Remember how we did before? So those of you that do not have a screen, I would, and it kind of looks like this. You can purchase one at the front desk. They're like $5 if you want to, but you got to have both of these on in order to work on clients. Now, because you're getting up rather close and they won't be wearing one in certain procedures. So you have to be able to protect yourself. Okay. Have you guys got this up off the page yet? Sarah and Araceli?
Yeah, I'm good.
Okay. All right, so this next part is going to be the post-operative complications. And these are the bullets. Okay. So that top part where it says early detection of post-operative complications can prevent major side effects, poor healing and scarring. So estheticians who work in almost any medical setting need a basic knowledge of the post-operative surgical concerns and possible complications. These would include the following: wound healing, that's for your first bullet. Okay. Bacterial infections. Okay. Yeast infections. Candida. Oh, somebody got bumped. All right. Okay. Conjunctivitis, which is also known as pink eye. Herpes infections. Here, look at this going here. Sorry. Okay. Ecchymosis, which is bruising, and erythema, which is redness of the skin. So that's got 1, 2, 3, 4. Okay, so you have yeast infections, and bacterial. I'm trying to find the other ones. Okay, the other two are burn care and possible complications. They're not up on the screen. Burn care and possible complications. And the next one would have been early signs of scarring. Let's see, I just want to check this to make sure it's not on the next page for you. No, it's not. Okay, coming back this way. It's not. So that should complete all of your bullets, correct? Am I right?
Yeah.
Okay. All right. Does anyone have any questions about what's on the screen? Okay. Even if you saw this on a client, okay, you would be working on them. Okay. Let's say somebody had herpes. You cannot work on them until they're completely healed. And you can't work on somebody when you have a cold sore. You've got to wait until it's completely gone. Okay, and I know I've had students come back and say, my doctor said I could come, you know, I'm safe to come here. I'm like, you're not though. You're not safe to come here because you can't work on a client. Okay, not even with a mask, you really can't, because it comes through your fingers. Okay, it can literally come through your fingers and go into a client. So you can put it on her face some other place. So no, you're not. So you wait until they're cleared. And if they have it, you can't just work around it either because it's within their body. Okay, just an FYI, you could spread it for other places on their face. All right. I'm going to move to page 435 then. Okay, and we're going to break these down, the ones we were just discussing. Okay, and these are definitions. Okay, so on a wound, this is basically a break in the continuity of the skin that's either caused by trauma to the tissue or a wound that's healing improperly. It will appear either yellow, and because the wound that's healing properly appears red or pink. All right. All I want you to write in there is up to the part where it says red or pink, that whole area. A wound is a break in the continuity. Because I'm going to give you a little bit more information after the pink. So let me know when you've finished. Does your textbook or your study guide have the 6 signs of infection already filled in for you? No, okay. That's fine. So if you look at the top part where it says a wound healing improperly appears yellow, okay, if you see green, this is going to mean it's viral, okay? You see a green discharge is going to be viral. If you see yellow, it's going to be bacterial. Okay, and if you see pink, it's healing. All right, the 6 signs of infection are pain, swelling, redness, local fever, which means there's heat to the touch, okay, throbbing, or pus, or discharge, however you want to read that, okay. Any of these signs, we're not working on a client, okay. So once you get your 6 signs of infection, which should be part of your wound healing, but does it have the 6 signs written in at least on there for you in your study guide? No?
No.
Okay, so after you write the green and the yellow, giving you what kind it is, okay, just write 6 signs of infection. So obviously pain, you'd have to ask the client if there was some pain, but if you can see swelling and redness and you can feel heat, like right above the area where you're putting your hand, you don't even have to touch it. You can usually feel body heat about an inch away from our body. Okay, and throbbing, it's going to be red and swelling if it's throbbing. And we already know that pus and discharge is not a good sign. Did you get it in? How about you, Araceli? You still writing?
I'm done. I got it. Thank
Okay,
you.
all right. I'm going to change the page. We're going to go into infections. Okay. And bacterial infections. Okay. They develop when the microbes invade an injured, open, or wounded part of the body. That also goes into your bacterial infections. Okay. They develop when the microbes invade an injured, open, or wounded part of the body. Now, symptoms basically on this one would include redness, soreness, and the presence of pus. Okay. So that's not really on there. So you can add that to the bacterial infection, that the symptoms include redness, soreness, and presence of pus. How you doing, Yusara?
I'm good. Thank you.
Okay, good. All right, conjunctivitis, which is also known as pink eye. It's an extremely contagious bacterial infection that affects the membranes that lines the eyelids. It's characterized by red, itchy, watery eyes, and they end up transferring it back and forth to each eye when they're rubbing it and they don't wash their hands, or they don't clean the bacteria off their hands. They don't realize they're transferring it either. But little kids get it all the time, okay? And then you have your yeast infections, which are going to be that superficial fungal infection that will occur on moist areas of the skin. The symptoms on this one are going to include extreme redness, clusters of large pustules, which can develop into scaly patches. Okay, there is some type of itching also. And then you have your herpetic infections, which is your cold sores, okay? Also known as herpes simplex 1. It's a highly contagious viral infection that are triggered when the body or the skin is placed under extreme stress, such as a laser treatment or a chemical peel. Okay, I'll wait until you guys get that information in there. And symptoms on the cold sores are going to be tingling, itchy, or itchiness, and tiny pustules. So clients that are prone to cold sores, usually, if they're getting a peel from a physician, he'll probably prescribe them something for the cold sores before he does the peel, because once you traumatize that tissue, it probably flares up a cold sore. So that's why they like to give you the medication beforehand. No. All right. You still working on this part? You finished? How about you, Araceli? Are you still writing? It's okay if you are, just let me know.
I'm good.
Okay. All right. You, Sarah, have you got this part filled in also?
Yes.
Okay, good. All right. And I'm gonna change the page here. We're gonna go into ecchymosis, which is bruising. Okay, it's the clinical term for bruising of the skin, and it's produced when the skin is traumatized, damaging the capillaries and causing blood to pool in the traumatized areas. Okay. Sometimes it's really heavy too. Erythema is the redness of the skin. This is the clinical term for redness of the skin, obviously. Common after chemical peels and surgical procedures, and needs to be monitored to prevent an infection. Also happens when you're doing extractions, you're going to get redness. And we don't have lights here, but they do have certain LED lights that you can apply to the skin to calm it down. And then you have scarring, which is an early detection that can either minimize formation with the proper treatment and hydration of the skin, as well as mild keratolytic ingredients that can keep the scars manageable and unavoidable after some procedures. Okay, the sooner they can get to that wound to heal it and make it look better, the better, I guess you could say. Because some people scar like a raised scar, and sometimes it's dark and sometimes it's light. Sometimes it's a depression of a scar, and sometimes it's light, sometimes it's dark. So it just depends on your body. What's really weird is I scar light on the top half of my body and I scar darker on the bottom half. I don't know why, but I have a scar on my knee and I have one on my finger, and they're both different. One's light, one's dark. Okay, yeah, 4.1 was supposed to be done last week. Yep, just making sure. And you guys can let me know when you guys have gotten all of this completed on your pages. I'm going to try and get through this part of the lesson plan before break. Hopefully. How are we doing? You finished? Okay. All right. So let me change the page here, and we're going to go into the burn care on the next page, which is on 436. Let me get this to move. Here we go. All right. I'm going to let you know how we're going to fill this part in. All right. Okay, it looks like our bullets are going to be what we're going to put into our boxes. Okay, just an FYI. So that first degree burn, okay, your first box there, it says the least severe. Okay, it only damages the epidermis. That's your first box. Your second box is going to be the skin is red and sensitive. The third may be produced by mild sunburn or brief contact with a hot object. A fourth one would be to treat with topical skin preparations such as aloe vera, antibiotics, and antiseptics. And I'm going to back that up just a little bit, okay? As far as we are concerned with anything that happens like that here, it's cool water. That's all. We're not going to put aloe vera on it, okay? Especially if they're thinking, let's say you had a burn from a chemical. you have to make sure that that chemical is completely off that skin before you try and put aloe vera on it, because what happens is because aloe vera is a carrier, it pushes the chemical deeper into the skin when you put it on top of it. So in our instances, unless you're with the doctor and he tells you otherwise, we're only going to be putting cool water on the skin. Okay, no aloe vera. Because sometimes you may not have gotten it all off, and then once it gets penetrating deeper in the layers, it's not gonna feel any better. It's gonna feel worse because you won't be able to cool it off at that point. So aloe vera is not. Okay, and the last one is to rinse in cool water or apply cold, moist cloth. Your second degree, and again, these are all your bullets, okay? The more severe and may require medical attention. It damages and penetrates to the dermis, which is that next layer. There's going to be redness, swelling, and blistering, okay? It's produced by a severe sunburn or contact with boiling liquids, okay? You're gonna immerse the burned area in cool water, and if a blister forms, you are not to break that blister, because that's an easy way of an infection to get in. And your third degree is going to be the most severe, okay? All of the layers of the skin and underlying tissue are going to be damaged or destroyed. The nerve endings may be exposed. You might see fat, muscle, and bone may be also burned. The skin is charred or whitened. It may require skin graft surgery, in which a section of the skin is taken from an unburned area of the body and surgically reattached, and frequently treated with an antimicrobial dressing to make sure that you don't get an infection. There we go. So all of those little bullets are boxes under your first, second, and third degree. I'll let you fill that in also. So all of this should be, most of this stuff is referring to working in a physician's office because that's what this chapter's on, okay? But for us, we're just going to put cool water on anything, even if we had a chemical peel, okay, that might have left a mark or something, right, left it real sensitive. We're still just going to put cool water. If you ever get to in a situation where you can't calm that skin down, let's say after a chemical peel, distilled water and baking soda will be your best friend. So I always kept a little bit in a bottle right next to my treatment table in case of an emergency, because it'll neutralize anything, at least anything that's an acid, okay? Most of the products that we put on the skin are going to be on the acid side. So it'll stop anything from continuing to irritate. You can apply it with that little squeeze bottle that I have and some cotton. Perfect. Because some of your peels that you may be exposed to or might be using might require you to use water. They might require their own neutralization. They might require you to mix distilled water and baking soda. So they're all a little bit different. Some of them even are just air neutralized, believe it or not. They only work for a certain amount of time and they just shut off. They're automatic shut off. It just depends on which one you're going to be using. So here at Adrian's, you will be using the Dermatological peel, which does have its own neutralizer. How you doing, Megan?
Good.
Good. Okay. Megan, are you going to be one of our models for the spray tan?
No, I want to
got a
learn
good-
to spray tan.
What?
I want to learn to spray tan.
You don't want to get the spray tan before you go in?
No. Well, I mean, I guess we could try and spray tan my tummy.
You're right. Are we going to be waxing you before you go and give birth or not?
No, I hate body waxing.
I just thought I'd ask. Let us know what we're up against.
You can do my eyebrows though.
I know, huh? You really need them. You can be my model, okay?
I do really need them.
You haven't done anything to them since the last time, have you? Like
No.
reshape them? Okay. All right,
No.
then we're good. Because you have nice brows. Okay. You still filling in, you guys, Sarah? I kind of look for you, Araceli. It's okay.
Yeah, I'm almost done though.
All right, hon. My goodness. I'm looking at today's assignment. It's going to actually be 4.2, and I want to see how much is on there for your homework. So when you guys go into break, okay, I will check to make sure if I have to assign more homework than what you already have set up as far as 4.2. I was watching some show last night. It was kind of crazy. It was like that 911, but a volcano like just came up out of some what is it called? A little gulf. What do they call it? A gulf. It's like immature. I don't know how to say it. Immature golfing. It's like for golfing for kids or whatever they call it. I don't know. Anyways, there's volcano came up in Texas because this is where this show is actually produced, I guess. And because of the climate change, is that what they're calling it on? And this poor man fell down inside where the heat was, and it was like 330 degrees in there, and he started to melt on this rock that was inside of there. And all I kept thinking was, oh, one of them tried to pick up somebody by the arm, and then their whole skin came off of their arm. It was like sad. I just kept thinking, oh, bones. I'm like, oh no, that's got to be worse than just being in a bad accident and there's a lot of blood, just to see a burn victim, like where their skin comes off. It's sad. All right, you guys ready to move on? Okay. All right, we're going to go into medications that are used for post-operative complications. Okay. So your first one is going to be that topical medication, and it just means it's directly applied to the skin. That's all you have to put in there. Okay, applied directly to the skin. Now, anti-inflammatory medications, okay, are usually oral. They're used to treat inflammatory conditions like dermatitis. They also make the skin thin and increase its sensitivity. So examples of these creams could be steroid creams, even cortisone types of lotion. So you've got, whether you're taking it orally or applied topically, okay, you're going to get the same side effects, okay, where it's going to thin the skin. Only when they do it orally, what ends up happening is it's all over their body, not just the area that it was treated. So topically is only going to be the area that's treated. If you take it orally, it's going to be their entire body, so you won't be able to do waxing in certain areas. Okay. Keratolytic medications are creams or ointments used to promote rapid cell turnover and exfoliation. So it's speeding up the cell turnover, okay, just bring up that new skin. Okay. And then you have your antibacterial medications, which are used to kill the bacteria and prevent them from reproducing. So on your keratolytic medications, this often causes the skin to become very dry and flaky, okay? So it's the normal process. So if they're complaining about that, that's normal, okay? Just like a peel. When they start peeling on it, it's supposed to do that. And it does not mean that they didn't get a very good peel if they don't peel either, because it takes the top layers like it's supposed to, and it's not going to go any deeper than that. Okay. I lose you? Did I lose you, Sarah?
No, I'm here.
Okay. I have like 4 blocks, okay, with you guys, with your faces on it, so I have to keep refreshing it so I can see everybody. Are you still writing, hon?
No, I'm good.
Okay, all right. So we're going to move on to the next page, which is 437. This is going to be systemic medications. Okay, and these are taken orally, and they travel through the body through the bloodstream. They're frequently used to treat skin disorders and diseases and to promote healing following surgery. Okay, that all needs to go into that area where it says systemic medications on your study guide. Your antibiotics, also, it's used to treat a variety of conditions. The primary function is to kill or prevent the growth of bacteria around the wound. Oral antibiotics can cause skin dryness. So that's another thing you have to think about. Okay, it's going to make it think. Have you ever taken antibiotics and says, do not go out in the sun, right? Stay away from the sun. Okay, it has these little side effects that you want to make sure that you're checking out for. Because a lot of girls are going to the tanning beds and they were on tetracycline. They couldn't figure out why the drug wasn't working. Okay, you need to follow all of those instructions. Antihistamines, okay, these are frequently prescribed to relieve uncomfortable skin conditions like itching or hives, and they can extended use can cause dryness and dehydration. So you're not going to be doing any waxing either on the top of that. Okay, so under those antibiotics and antihistamines and Accutane, definitely, there's not going to be any waxing or exfoliation during this time. Okay, and Accutane is an oral drug, okay, derivative of vitamin A. It's prescribed for severe cases of acne and certain skin diseases, but it works by inhibiting the functioning of the sebaceous gland. And that means all over your body, not just on your face, okay? So most people complain that everything that all their glands are like drying up. Their nose dries up, their eyes dry up, okay? Anything that's actually being depleted from the body, it dries up while they're taking this. You have to check with your doctor because sometimes it's pulled from the pharmacy and other times they put it back on. Right now, I think it is back on there, but since I've started teaching in '96, it's pulled like numerous times saying, it causes kids to get schizophrenia. It's just really bad doing this. You have to have liver panels done every 3 months, which is not so great. If it's doing that much damage to the liver, I'd find another way to cure that acne.
I know
And
someone who took it. I know someone who was taking it and they had to they had to go to the doctor because it was making their brain swell.
Yeah, it has really bad side effects. And you know me anyways, I'm like, if I can do it topically, I'm going to do it topically first because it doesn't do any damage to the other organs of your body. Okay, why not try first topically? Whether you're using electricity or something, to clean it up. Okay, so once you fill this part in, I want the newer girls to think about this question. It says laser resurfacing is a medical procedure that many believe carries a high risk for patients. Can you explain why you think this belief is true? And if it has anything to do with, let's see, anesthesia, that's the main reason there's a risk for the patients. Okay, because if they go under, there's too many risks for that. Okay, blood clots, all kinds of stuff, not waking back up, being number one, but that's basically the reason why they are high risk for patients. And then there's also a risk later on about infection that could possibly be if they're not taking care of the wounds. Okay. Why is this not? Sorry, you guys, I'm just going through, checking on you guys. There we go, back. So all 3 of these, no exfoliations and no waxing. Okay. Because what's going to end up happening is you're going to take that top layer of skin off and it's going to feel to them kind of like a rug burn. Okay, it'll be red. So we're going to be doing waxing this week too. I'm like so excited. So if you have any hair you were thinking about shaving, don't. Okay, I need 1/4 of an inch. And people don't grow hair in a week, okay? No matter how hairy they are. It just doesn't happen. I know for a fact that I could shave in the morning and then by the afternoon, if it was really cold, I would have nubs by the evening, okay? I'm like, this is ridiculous, right? And you know why you do? Because you are cold, okay? It pushes that goosebump, okay? Pushes it up through the follicle and fills it in to try and keep you warm. So it pushes up whatever hair is left underneath the skin up to the surface. It's doing like a contraction. Oh, push the rest of it up. I'm like, don't be cold, don't be cold. Okay, once you're finished with this, look at your learning connection at the bottom of the page. And it says a specialized medical professionals perform many different medical procedures. Match the procedure in column A with the appropriate description in column B. So obviously, only people that have their study guide with them can do this little exercise. But I'll also give you a couple of minutes to finish that. I don't even think they gave it, they don't give these on the slides though, I don't think. I'm gonna move this just for a second, I'll bring it back.
Where is that at, Miss Janie? Because I don't see that.
Okay, I didn't get, do you have at the bottom of the page 437 on the worksheet that I handed out?
Hang on, let me see. Well, what we were just writing on?
Uh-huh,
It doesn't say that on there.
what does it say?
It just says laser resurfacing is a medical procedure that many believe carries a high risk for patients. Explain.
Okay, and then it doesn't go into the learning connection below it? No? Wow,
No, I mean, not on mine.
not on yours? That's weird, huh? Because it's like, look, I'm like, if I photocopied that page, I would think that, can you see this? Like, it's on the
Yeah, that's how
same
my
page.
textbook looks.
Yeah,
Is that what yours looks-
it's
But
not
yours
printed
doesn't,
on
huh,
mine.
Sarah? Oh,
Uh-uh.
wow. It's weird. Okay, don't worry about it then if you don't have it. Araceli, do you have that part?
I do.
You do? It's
Mhm.
weird, huh? Did you have this whole page though, the systemic medications?
Yes.
And Sarah, you did too, but you just don't have the bottom, huh? They didn't photocrop the rest of it?
Yeah, it's weird. I'm literally missing that part.
Oh, you know what? Did Connie give you those sheets? She might have like, I know what she did. She did it off of the computer when you roll it off the computer, and I had already had one copy done, I think. So my copy had it on because I did it from the book. She did it from the computer, and the computer doesn't pick up when you just run it off on the computer through the copier. It doesn't pick up the
Oh.
lesson plans, these little learning connections on there.
Oh,
So don't
okay.
worry about it. They're
Okay.
just little exercises. Yeah, they're asking about a chemical peel and collagen fat injections, blepharoplasty, dermabrasion and dermaplaning, and rhinoplasty, which if you guys have finished this already on this screen, I'm going to just move to the exercise right below it because it's the self-check. It's basically the same thing, okay, as the exercise for you. Okay. And so then we just do this out loud. Okay. So a blank is a physician who specializes in diagnosing and treating diseases of the skin and nails. Can we think of who that is? A dermatologist, right?
Yes.
Okay, so number 2, I'm going to give you, let you guys figure this one out. A blank is the use of chemical solutions to exfoliate the surface of the skin, promote cell turnover, and induce desquamization.
Chemical peel.
Chemical peel, good. All right, 3 is a blank and blank injections fill increased, furrowed, or sunken facial skin lines and wrinkles. Anybody want to take, it's on your, actually on your learning connection if you do have it.
Collagen and fat
collagen?
Yeah,
injections.
collagen and fat injections, yes. Okay, and then number 4, blank and dermaplaning are surgical procedures that improve uneven skin textures due to acne, facial scars, and fine wrinkles by mechanically scraping off the top layers of skin. Anyone want to try that one?
Dermabrasion.
Yep, that's it. Okay. So go to. Okay, the rest of this. Number 5 is an eyelid surgery to remove excess fat, skin, or muscle from the upper and lower eyelids. This would be your blepharoplasty. Okay, 6, blink uses a beam of highly focused light to vaporize the upper layers of the damaged skin at a specific and controlled levels of penetration. Anyone want to try that one?
Laser resurfacing.
Yep, laser resurfacing. Okay. 7, 2 categories of lasers are used in laser resurfacing. Blank and blank. Do anybody remember what they were? I'm going to say one of them says non in front of it, so I'm giving you a hint. It starts with an A.
Was it non-ablative and ablative?
Yes, that's right. Non-ablative and ablative. Okay. And then blink is surgery to reshape the nose. Just like the animal.
Was it rhinoplasty?
Yes, rhinoplasty. Okay. So it's going to go through and make sure we have the right answers. So here they are. We had the dermatologist, we had chemical peel, we had collagen and fat injections, dermabrasion, right? We had all those. Is good. All right. And blepharoplasty, laser resurfacing, ablative and non-ablative, and rhinoplasty. So we've covered basically the facts. This is what we've covered so far in the chapter. The majority of physicians who utilize the skills of estheticians are dermatologists and plastic surgeons. The dermatologist is a physician who specializes in diagnosing and treating diseases of the skin and nails. And a chemical peel is the use of chemical solutions to exfoliate the surface of the skin, promote cell turnover, and induce desquamization, which means shedding, peeling, or coming off in scales of the stratum corneum, which is that top layer. Okay, these are the important points. Okay. All right. A plastic surgeon or cosmetic surgeon is a medical doctor who specializes in cosmetic or reconstructive surgery. Now, the depth of penetration and the results achieved depend upon the concentration and type of chemical used, as well as the pH of the product. Do you remember what I told you the pH and the percentage was that we can use as an esthetician?
Was it 30% and 3? And lower than 3?
Yep, it's 3.0, and 30%, correct, good. All right. The Aesthetic Manufacturers and Distributors Alliance, which is known as EMDA, has established procedural guidelines to ensure safety and consistency in the use of alpha hydroxy acids that are used for chemical peels. According to their guidelines, estheticians are only allowed to use alpha hydroxy products with a maximum of 30% acid and a pH no lower than 3.0. Okay. See, I asked you before we brought that one up. That basically covers, there's a little bit more. All right. Generally, estheticians are only permitted to perform light or superficial peels, and medium to deep peels can be only performed by a physician, regardless of the type of peel performed. Direct sun exposure should be avoided for at least a month. If they go back out in the sun regardless, okay, they're setting themselves up for more hyperpigmentation, so it's not such a wise idea. But I've had people say, can I go tan? And I'm like, go ahead, I need the money, because I'm just repairing what you just did to it, so go ahead, keep continuing to do it. All right, collagen and fat injections filled in creased, furrows, or sunken facial skin, lines and wrinkles. Okay. All right, and collagen is a natural occurring protein that is a component of human skin, joints, bones, and ligaments. Our fat injections are also called autologous fat transplantation or micro-lipo injection. They're used to treat sunken cheeks, laugh lines, skin depressions or indentation, forehead wrinkles, or to enlarge the lips. Okay, and I've got just a little bit more here. Okay, blepharoplasty is the surgery to remove excess fat, skin, or muscle from the upper and lower eyelids. And then a facelift or rhinoplasty can improve the visible signs of aging by removing excess fat, tightening underlying muscles, and redraping the skin of the face and neck. A bad facelift when they don't do the neck. Okay, they just left this hanging and the rest of it's pulled up. And trust me, I've seen it done. It's kind of bad. All right, laser resurfacing uses a beam of a highly focused light to vaporize the upper layers of the damaged skin at a specific and controlled levels of penetration. Rhinoplasty is the surgery to reshape the nose. So that's your face the facts for the chapter. All right, I'm going to give you 10 more minutes. Okay, I'll see you back here. My new students, just stay logged on. You can walk away from the screen or whatever, but just don't log off or go out to the room, okay? So I'll see you about 10 minutes after, okay? See you back then. Stop sharing this one because I'm gonna have to bring up the other screen. All right. Okay. The new one.
Nobody seems to want to keep the top section, the front section out.
Uh-huh.
But it's in here, it's not for the top of the head from the front down.
Yeah, it's basically right here to back.
But
You don't ever do the front part of it though. You're supposed to know, yeah, you're supposed to know that
It
you,
doesn't matter?
yeah, huh?
Oh, okay.
It just means that you're supposed to do this whole part, okay, not just like from here back.
Oh, okay. Never mind. That's what-
Right. And they just have to be strategically placed. Okay. The Zooms. Oh, I gave it to Sue already. Yeah. That's okay.
Because I'm like scared of mine.
They're the crunchy ones. Mhm. Session. Oh, I was just putting your homework assignment together. And I'm just going to send it to you now. So it should go out to everyone. And then we'll explain it. And let me know when you guys get that text message. Jasmine. And let's see. Jasmine and Alex.
Yep.
Let me know if you get this text message, okay? Because I want to
Yeah,
make
I
sure
got
that
it.
you got it. Okay, you're not going to have to do that homework. I just want to make sure you were on my list.
Okay.
Because I try to get her to leave somebody there, you know, put you guys on the list so that you get my texts all the time. Because I put it in a group so I don't have to do it 50 times.
Okay.
Wait, it's supposed to be 14.2 or 14.1?
14.2, because last week it was 14.1, I think.
Oh, okay. I can't remember.
I went back to look at it, so.
Miss Janie, I don't have any of those pages in my study guide.
I know, what I'm gonna do is I'm gonna photocopy and I'm gonna send it as a text to you.
Oh,
Okay.
okay.
Yeah, don't worry about that. Because everyone else, Natalie, do you have this part? Those pages in the text part?
No, I don't think so. I have
You got
the,
the package, right? I thought I did yours all the way through. It's not a big deal. I'll just put two of them. I'll, you know, send both of you the package.
I know, so I have the matching one.
Is that where it cut off?
Yeah, I think so.
Okay. So what I'm going to do is I'll send it to you. Is everybody else have it in their book, right? So they can take a picture of it once they finish it. All right. Otherwise, I will send you the package, that part of the package. Okay.
Okay.
All right. So hold on one second. Okay, give me 1 second. I gotta catch something really quick. Okay, I just had to go get something from, they brought my truck. My truck was frozen this morning, so I couldn't even drive it. So when it thawed out, they drove it over here. How crazy is that? Okay. So everyone else has the homework assignment, right? So all you're gonna do is the matching, right? And then you're going to go to, oh, my goal list here, sorry. Okay. You're gonna go to the matching. You're gonna do the knowledge grid, because this is that same information we just covered in class, so it should be really easy to fill that in. Okay, then you're gonna do the brain conditioner. Okay, that's in your book, all right? I want you to decide, that one's different. Then I want you to go onto the computer and I want you to go to lab. Okay, and when you come up to the lab, you're gonna go into learn, all right? And on learn, you're gonna do 14.2, which happens to be the talking points or discussion. It's got something for you to do. Also, it has show, you know, under the assignment, you're gonna do that. And then you're gonna take the challenge on that one. And the challenge one is the one you have to submit. So on talking points and the assignment, you don't have to. You have to actually take a picture of it and send it to me, right? And then the challenge on the computer, you have to actually submit, okay? Because I'll get that text. All right, does everyone understand that part of it? Okay. So let me know if you don't understand it so that I can go through it. I'll break it down and at the end of class, right? I'll just pull up all the work so you can see it one more time. Right? Everybody good? I'll go through it one more time at the end of class, okay, Yusara? Okay,
Miss Jenny.
yes,
Okay, it's 440, 442
yes.
until 400. That's 450. Okay.
Yes,
Okay. Thank you.
okay. And then you have to do the other one on the computer, okay?
Yeah. No. This is
14.2.
about the book. This
Okay,
about the
yeah.
book. Yeah.
Okay, then we understand, good.
Thank you.
And then I'm gonna actually go through that on the computer to show the other girls too, just an FYI, okay? So we're down at the very bottom of this actual chapter here. So I think it's only this last 2 pages that's left. All right, so let me share the screen with you. Okay, everyone's in. Okay. And I had to put up 14.2. So let me know when you see the advanced training and the continuing education scope of practice. Because that scope of practice is part of your homework assignment on the computer. So I'm just giving you a heads up on that part. Okay. All right, so you should have continuing ed, right? The first part of that top of page 438. Let me get this to move. Come on. Can't get the screen to move. Sorry. There we go. Okay. Following this lesson, you're going to be able to identify the various ways of gaining additional and advanced training to become qualified to work in the medical setting. Define the phrase scope of practice. Okay, that's what you're going to learn today. So your advanced training. Okay, your continuing education credits. These are required each year by many professionals or professions as part of their licensing agreement. And it's guaranteed that you are a good standing status with the regulating agency that oversees the profession. However, you are not required unless you are educators in the state of California for continuing credits, okay? As estheticians, you don't have to do that unless you are an educator, all right? So if you're not taking classes though, then you're not widening your horizon, I guess you could say, you know, because there's always new things that are coming out. So I would take classes, okay? But it's not required to show that you get those credits. There's 2 important considerations, okay? The necessity of pursuing additional professional training and support. Let's say you wanted to take an additional tanning class, or you wanted to take a lash class, okay? Or, you know, makeup. That's all additional for your information. It's not required, okay? The difference in legal and liability exposure on what you're covered for. But what I want you to put into your workbook is the first paragraph up here, and where it has the 2 important considerations, they're going to go into those 2 boxes on your study guide. Okay. So there always are shows, usually when everything gets back to normal, they promise they're going to be back putting these shows out in expos, but for aesthetics, there is the IBS show, which usually happens around Super Bowl Sunday, that weekend. Okay, February, like January, February. And that's the best time to go to Disneyland, let me tell you, because nobody's there that weekend. All right, so there's a big show down in Long Beach for that. Okay, it's the West Coast biggest show, all right? And then they go to the East Coast and they have it over in New York. All right, the other one is the one that's for skin, and it's skin usually in manicuring. I don't know why manicuring kind of slid underneath there, but it's basically a skin show and it's huge, okay? And it's in Vegas once a year, okay? That one usually has 2 convention centers. The one in Long Beach has 3. So they're big shows. All right, there's another one that's called, or put out by Skin Inc. magazine, that's held in San Jose. This is just for skin. Okay, these are shows where you can actually take additional classes. I should warn you though, when they have these conventions and they offer these classes for you, don't take classes that are like 15 to 20 minutes or even an hour long if it's talking about product, because it's usually a product knowledge class. So they're not giving you any information. They might do a demonstration, but they're not doing anything other than what you would normally see if you saw someone give a facial with their product. The classes that you would like to take are the ones that are talking about ingredients, okay, and telling you how to use those ingredients. And I'm only going to put this out there because Dermatologica has a separate type of class. It has classes for their products, like how to use their vitamin, how to use their peels, you know, that type of class. And then they also have from their parent company, which is the IDI, and I know you've seen the logo, on our website, but it's IDI stands for the International Dermal Institute. And then those classes are taken to show you how to use certain ingredients in your product. So they're not pushing a product. They're not pushing this line, not saying you use this cleanser and this body treatment for that. It's telling you ingredients that you would be using. So this is where your knowledge is going to be set in there. You don't have to use their product. You can use a product that's different that has those ingredients in it. Does that make sense? Because that's what you want to be able to do. I know how to give the procedure. I just want to use different types of ingredients and get certain effects. And that's the type of class you really want to get to, unless it's a class also for equipment that you're not used to. Okay, but when you buy something, they're supposed to give you training. When you even buy product for your salon, whether you use ours or somebody else's, they should give you classes on it, because they don't want you out there using the wrong way. You know what I mean? They've got to give you instruction on it, and it's free. So a lot of these companies will go to these skin shows and offer these classes and charge you like a $20 class. And basically all it is the product knowledge for that product. So I'm giving you a heads up. Nobody told me ahead of time. And I actually spent $100 on a bunch of different classes one time. I was so angry because I'm like, I didn't learn anything. I learned about their product, but big deal. I could have done that, online. So there's your little tidbit of knowledge. All right. So we're going to continue down to the bottom where it says continuing education. Okay. And all I want you to put in there right now is the additional training and education can be obtained through a network of professional and industry connections, which means additional classes. Okay. Some of these classes will offer credits. Some of them do not. So before you take a class, okay, ask if they're going to give continuing educational credits. It's going to be CEUs. Okay. And again, only if you're an educator, like if you're a teacher in this field, then you have to do your credits every year. Okay. In your medical facilities, okay, all of this is going to be put into that section. So I'm just going to read it to you. Okay. You may already have various trainers in place to educate you about the specific medical environment. OSHA requirements may be outlined to you by a designated trainer in the medical office. You want to take the initiative to research the employer and the employer's procedures and practices, and make sure you remain within the scope of your competence, licensing, and prior training once on the job. Okay, don't be conned into doing something because the doctor said you could do it. Because if you mess up, the doctor's not going to back you up. He's going to say you did it without his permission. Trust me. He's not going to give his license up for, for us at all. All right, so just stay within your scope of practice. I took an additional medical class. It was giving me front and back office, I guess, experience. It was a 9-month course, kind of like what you're taking, a vocational training. And I didn't get anything that I could use in a doctor's office, to be honest with you. So don't waste your money on that. Okay. Most of the time they will train you, like this says, to do what they want you to do inside the office, but you don't need that other class. That was like $19,000 I wasted down the drain, to be honest. Yeah. It was $19,000 for that class, and it was 9 months. But there wasn't one thing I could use that class offered. Not one thing. I'm sad to know to say that it's bad. But a lot of places would like to hire students right out of school because they can train you the way they want to. People that have already been in the industry, they're a little harder to break of their bad habits, they say. So don't feel bad. Anytime you go for a job in this industry, I always tell the girls, go and sit in the lobby if you can and watch how they are handling their customers or their patients, whatever it is that you're going to see. And then watch how the employees interact with each other. Is that a place that you want to work at? Because a lot of times you can feel the tension just sitting in the lobby, like looking through a magazine or something. It doesn't really matter. I used to give the excuse, I just want to see what services you offer. Can I just see a menu and I can sit down and I just listen to what's going on? Like, do I really want to work in this type of a place? Because if you don't, it'd be bad that you got the job and then like 3 days later, you're like, I can't handle this stuff. Okay, I'm out of here. Maybe it's because the people you just couldn't get along with, or they didn't get along with each other and you didn't like that. Okay. So if they're smart, they're not going to show you any of the bad stuff. Hi, congratulations. Our receptionist got her license. She went yesterday, I guess, and got it. So now she's a cosmetologist.
Like went for the state board exam?
Excuse me?
You went to the state board exam?
Yes, she did. Uh-huh.
Oh, so they are, they
But
reopened?
she, okay, she went to the written part of it. She didn't have to go to the practical part.
Okay.
But because they're letting people out, they might have opened it up though this week. That's what I'm thinking. Because we can do a couple of things, so they might be letting you guys do it. Hope. I won't know everything until tomorrow. But I do know that we're gonna get some hands-on at least, so we won't be so bored.
Does that mean that we're getting our kits soon?
They're not here yet though, but soon. Whatever you need though, while we're here, I'll let you use my stuff. I'm not gonna let you not have anything to work with, okay? Besides, I gotta get rid of my stuff anyways, because after, I got a couple months left on that, and it's not gonna be good enough to use on clients, so. I mean, it's still good, it's not expired, by the way. I don't want you to think that, but it won't be for much longer, okay? And I've got that whole cupboard that I can get rid of. I've got stuff that haven't even been opened yet, and I've got to use it. Okay, so I'm writing out a list for me. I've got to photocopy these pages for you. Just 2 of you need that, right? Nicole, Natalie, and Sarah. Anybody here from our Toriana? No, I haven't either. Okay, I'm just asking. Sometimes you guys, you know, talk after school or whatever. Okay, and then I need book, and then I need Alex and Jasmine need papers, and Natalie, you're probably going to need, you and Sarah and Araceli are probably going to need homework for tomorrow. I think I photocopied some stuff, right? Chapter 9 already for you guys? Okay, so then you don't have to come in. But Natalie, you haven't been in, so you might want to come back in today. Okay, no later than tomorrow.
Okay.
I mean, like early in the morning if it's going to be tomorrow, because we're going to be on another chapter tomorrow.
Oh, okay. Usually, so
Okay.
usually what I do is I go like on the smart notes on my computer and I just type it and then take a picture of it.
Okay,
So if
That's
if it's
fine.
the same thing on there, then I should be okay.
okay. That way you'll know, because we're going to be on chapter 9, right? That's next, right? 9 and then 6, correct? Yeah, okay. It doesn't go in order, my newbies, but
I know,
will
I could tell. I was like wondering, like when I started, like what you guys were going, what you
way
were
back
doing.
in
and
the
I was
day. Okay,
Yes.
literally when I started in 96, I did on chapter 1, okay, and went through
Really?
that way. But what happened was students don't graduate or they take a leave of absence and they miss things. And then I only have like 2 or 3 people left in the class that I have to switch it up because they got to take these classes because they weren't here before. So that's how it got sidetracked. So, okay. Everybody's finished with this, correct? All right, I'm gonna move this. Okay, there we go. Product, excuse me. So medical aesthetic courses may last 1 to 2 weeks. They will include hands-on training and provide condensed versions of what an esthetician will experience in the actual medical setting. Further experience is always necessary to build upon the foundation of the short courses that are provided. You don't have to put that in there, okay? Don't worry about that part.
That's not the last box that's on there?
Yeah, no, that's not what they want you to put in there. So
Oh, okay.
we will put it in there, but it's only the last part of it. It's the further experience is the only part that's going to go at the medical down at the bottom. If you want to put that in there, further experience is always necessary to build upon the foundation the short courses provide. That's the only part that you have to put at the very bottom where it says medical aesthetics courses. She's right. On that same page. And Natalie, you need a kit list, right?
Yes, please.
Okay. And the two new, Alex and Jasmine, you don't need the kit list until you come in on Thursday. Okay, on that kit list, or on your first day at school here, I guess you could say in the building, you have to come in the back door. Did they explain that to you?
Yeah, but I don't know where the back door is. They didn't show me.
Okay, so you just come into the parking lot and you're gonna have to go around the back of the building, okay? Don't come in too close or too quickly because you'll end up in the parking lot for that Goodwill or whatever it is, the thrift store. Because they put up a little hole in between there this last time we were on break. So you've got to come into ours and the parking is in the behind our building. Okay, so you'll see the back door. It'll be open tomorrow or Thursday when you come in. They'll take your temperature and make sure you're properly dressed and our aesthetic part is in the back of the school, the front of the school, I guess you could say. So you're gonna have to go on the other side of it towards the front door and then make a right.
Do you still
So when you
need,
get to
do
the clinic floor,
need me
you're gonna
to
make a
stay?
right. There's a door over there. You're gonna hit for that door on the right side of the building when you first come in.
do you still need me to come in today? Right?
You can come in, actually, this is where I'd like you to come in on Floyd, okay? Not the front door, but it's on Floyd itself, towards like this, I guess it's farther away from the front door, okay? On the side of Floyd, that's where I'm at, okay? If you can just meet me right there, okay? I'll let you in through this door, okay?
Okay.
It's 2 double doors and it's on the side on Floyd, okay? So if you were standing at the front door, you'd have to make a left, you know, yeah, a left. All right. You're gonna have to give me at least 15 minutes from when the class is ending so I can photocopy them for you, okay?
Oh,
All
no
right,
worry.
so let's
It's
move
a
on to this.
it's a 40-minute drive for me.
Okay. You have underneath this for you. Your product manufacturers, right? Professional associated educational programs. Okay, product manufacturers are professional associations that offer an educational programs. Can be product or not product knowledge classes. So it's many professional, it's professions and education programs that product only and product only. Professional though, okay, this is where they hold educational conferences. These are conferences that are held throughout the year. And that's all you're gonna have to put right there. Okay. Professional associations would be educational conferences held throughout the year. And then you're going to go into your next page. So let me know when you're ready, or if you need me to repeat any part of the previous page. So today, when they ask for you to describe the scope of practice, I'd like you to go onto the Board of Barbering and Cosmetology and look up the esthetician's scope of practice. Okay. It's a paragraph, maybe like 4 or 5 lines, I guess you could say. And it's talking about applying things, lotions and creams to the face. That's, if you find that area of then you scope of practice I'm at yet. I'll give you the whole thing because I want you to look it up. But you're going to go to the Board of Barbering and Cosmetology website. Okay, and on there you will find areas that will describe what a cosmetologist does, what a does and what a manicurist does, because those are the three areas of that field. So your regulating agency is the Board of Barbering and Cosmetology. That's who you answer to for disinfection and sanitation and for your procedures and for testing. So are you guys ready for your scope of practice? Okay. What's going to be put in there is this: the procedures that may be legally performed as defined by the local regulating agency, which can vary from location to location, which basically means state to state, because our license is regulated by the state. Okay. So you want to stay current with your scope of practice so that you know what procedures you can and cannot do. Okay. So all three of those bullets need to be put right there. And it says, for example, some areas permit licensed or certified estheticians to perform one-layer TCA pills or laser treatment under the physician's supervision, and others do not. Our state of California does not allow us to do a physician's peel, period. Okay? Some states, like we said, do, but ours does. Do a TCA as long as it's a 30% or points on the pH. Okay? Because we do have a TCA we use. Okay. But the acid doesn't go below that. So you only have to put what's in that little bubble, that pink bubble right there on your scope of practice. Basically what they're asking you when they say, what is meant of practice? It means it refers to the regulating procedures that an esthetician or a cosmetologist or a manicurist can perform. But you're going to give me the actual legal description from the website. So if you have your little learning connection at the bottom, I'm just going to go through that really quick. Medical facilities may have various trainers in place to educate you about specific medical environment. Product manufacturers will offer training and education programs that are not product specific or are product specific. Professional associations, these are holding your educational conferences. And then your medical aesthetic courses will provide a condensed version of what the esthetician will experience in the actual medical setting. I'm going to give you an example of the state of Utah has 600 hours for just a basic esthetician and 600, which is an advanced. They are actually allowed to do laser hair removal, and they can go deeper on their peels, but that's not what the state of California offers. The state of California does not recognize a medical esthetician. I just love it when they go, I'm a medical esthetician. No, you're an esthetician working in a medical office. There is no such thing in California. Okay, just an FYI. So if someone tells you that, it's like, no, there isn't. So like, tell them where'd you get your license at? Because I don't know that there is one. All right. So that covers basically our lecture for today, and I was going to go through our homework assignment to show you how to find that. Okay. To this page, and so I'm going to do lab workbook. So let me set up this page here so I can share the screen with you. Okay. There we go. All right. So I'm going to show you. Find our home. All right, look. My screen. Slides.
Miss Jeannie, you cut it off.
Work. The you start. Come on, are you kidding me? It's like realize you in there. Hi. Did I lose you for a minute? Like it just started going all nuts on me. I'll wait until this finally logs everybody in here and then I'll go through the homework. We'll start from the beginning. Okay, everybody's faces are back. All right. Okay, hold on 1 second here. I'm gonna pull up the website. I'll move you guys over here a little bit. There we go. Okay. Let me pull up Learn About Beauty, because that's where you'll go. Okay, you'll go to www.learnaboutbeauty.com. Okay. Once your textbook and stuff is downloaded onto your whatever you're using, tablet, book, whatever. Okay. And it's coming up. All right. Hi. I'm going to share the screen while it's loading. Okay. Just look like this. There we go. Actually have it on my desktop so I can see it. Okay. Where is it? Like, where did it go, huh? There we go. Come on. It's still spinning. The hamster's still working. Okay. When it finally comes up, it's going to have my little screen name. So you'll have to make yourself a screen name. And it's like taking, okay, hold on. Stop. Okay, let's get this thing going. Okay, I know you're still there. I'm still waiting for this. Okay, it won't let me share it with you until it logs on to the site. It keeps logging me off. Please, come on. Good Lord. Okay, as soon as I get this up, I will share the screen. Come on. Okay. Still spinning. There we go. Okay. Da, 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 da. Okay, come on. It's like right before the page. Okay. All right, I'm going to share what I have now. Okay. All right. Let me know when you see my pivot point lab screen up. Okay. So if you go to and you've logged onto your screen name, you're going to be on the home page. You see my cursor right up here where it says home, left-hand side. Okay. You're going to actually, before you do any of the homework, you're going to go down to where this clock is right here. So I'm going to scroll the page down, and this is where you do your tracking. So you would actually click on this, okay, and then go to do your homework, okay, or stay on for the 4 hours that you need to, because I've already given you 2 hours. You're going to stay either logged in, and sometimes if you finish the work before the the time is allotted, just stay online, but you have to move your mouse every once in a while because it'll log you off if there's no activity. Okay, you want to stay on there for the 4 hours so that you get credit for the 4 hours. All right, so you're going to click on this and it just automatically starts tracking your time. Okay, and then I'm going to go over to the learn, which is up here in that left-hand corner again. And I'm going to click on the learn part because your homeworks are always going to be in that learn area. So those are like slides and stuff that we watch. Okay. And so this is basically, I'm going to go back to that other page so you can see it, where I got this from, because it just brought up the last one. Come on. This is our tracking time. All right. So once I'm on this learn site, because I just wanted to go through that. Come on. You should see a gray area. There it is. You see this gray area? You're going to scroll down to where it says Salon Fundamentals. Okay. Once it spins over, this is where you will find your slides and homework. Okay. So what I'm going to do is I'm going to scroll down, and this is like chapter 1.1 and 1.2, 1.3. Do you see that? Well, we're on chapter 14, which we're doing. So I have to go down to the bottom and then go like to page 4, and then I'll have to go to page 5 because maybe it's spinning. Because I have to go to the last chapter of the book. There we go. Okay. So we are working on 14.2, which is okay. So you're going to click on the 14. Oh, there we go. Click on that part. It's 13. So sorry, right here. This is where we're going to go. Okay. All right. So the slides that we watched today are right here. You would just have to click on that and it'll say download on yours. Okay, right here. And you'll be able to see the same slides that we went through today. The homework now, okay, and your smart notes are going to be right here, which we fill in with this information from the study slides. Okay, your first part of this is the discussion. And you're going to click on it and it says research various programs in which an esthetician may be trained as a medical esthetician. Share your findings with the group. So basically you're just going to look up, you're going to have to go through other states, but look up estheticians in other states that require, that do have the medical esthetician program. And then just tell them what you found out. Okay, what kind of services can they do because they are a licensed medical esthetician. That's all they're asking you to do. So you write that down and then you take a picture of it and you send it to me, to the zip whip, okay, which is our telephone number. You just send it as a text. Okay, and then I'm going to go back to this, that page that we were on. So I'm just going to hit the back button. Okay. Right, and then I'm going to go down to where it says assignment. Okay, and I'm going to click on that. Okay, and it says research the scope of practice procedure in which medical estheticians can perform in your state. And then it has post your findings. But what I want you to do is go to our board of barbering and cosmetology instead of that actual, assignment. And you're going to look up your scope of practice for California. Okay, that's what I want you to write for your area that goes in here. Take a picture of it and send it to me in a text. Okay, then I'm going to go back and you've got one more thing to do on here. Okay. You're going to do the challenge. There are questions on. Okay. Down. This right here. This is. You're going to click on that. There's only 5 very bottom after you've answered all 5 of those. you're going to hit the submit button on this, okay? So anytime a submit comes up for like your assignment or your lesson challenge, don't submit it on the computer, okay? The only one that you ever submit to us as far as homework is going to be that challenge. Okay? So at the bottom, this one will say submit, okay? And that one goes right into the computer for your homework assignments, okay? Just that particular part of it, that challenge. Now, the homework in your book that I've actually had you do, it does have questions in there too, okay? But you're just going to take a picture when you, and that actually will come back. I mean, anything in the book that I've asked you to do, you're going to take it and say, okay? I'll go over this again with Alex and Jasmine, but do you understand, Natalie, what we're doing? Where'd she go? Natalie? Natalie?
Yes,
Can
I
you hear
do.
me?
Yes, I do.
Oh, okay. I didn't hear because you didn't have your sound on, so that's why you were muted. So I'm like, are you
Sorry.
talking and I can't hear you?
Sorry.
That's okay. Do you understand where to?
Yeah.
Okay. Any questions? Do you have? Where'd it go? Stop sharing. Let's see what you got. You, Sarah, where are you? Sarah? Oh, there. I'm like, where? Understand what we're doing for the homework? Everybody's frozen.
It's frozen.
Yeah. What's going on? Yeah, you're frozen. Okay, do you?
Yeah.
Yes, okay, are you sure?
Yeah.
Okay, so you have some pages, in your book, and then you have some on the computer, okay? Okay. All right, so I'm gonna send work now, so copies, and I'm gonna end the class. If there, now's the time. Questions? Okay, so I will see Alex and Jasmine here later today, I guess. And then through on your text messages, okay? And I will see you guys later. Homework. Bye. There we go.